Do I?
Are we recording?
Yeah, it looks like.
Yep.
All right, I'm gonna call the meeting to order. Any changes to the agenda? I think online we've got Ann, and then who's in the other box?
Dr.
Reed.
Reed.
Dr. Reed, okay. My eyes are good, but not that good.
Yeah,
All right.
sorry.
Hi, guys.
Morning.
Do I have a motion to approve the March minutes? So moved.
A second.
All right. All those in favor say aye.
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 Ann, would you like to vote?
Aye. Yes.
Do we have the
We
volume? up?
can't hear you if you're talking.
Check the computer volume.
Yep.
Might be something with the speaker. or something. Oh, I can faintly hear things through your computer.
Should be it. Try it again.
Hi, Ann, can you test your volume?
Can you hear me?
There we
Oh,
go.
there you are.
All right, would you like?
I said yes.
It's on the computer bar. Yeah. So I have to raise that a little bit.
All right, so Ann, would you like to vote on approving the minutes?
Yes, I say yes.
Thank you. All right, the minutes are approved. Do you have anybody for public comment? Nope. And nobody online? We're gonna move on to unfinished business. Appeal process for sewage disposal. Is that Dr. Reedy?
Dr.
Yes.
Reedy.
Yes, I did speak with our attorney, who will be speaking a little later. I also contacted the Commissioner of Health's office and spoke to their counsel, who agreed that the question between Board of Health policies and their policies should go to the Attorney General. So Nathan Cochran.
Yes, and let me just say, I've been unable to make that connection, and to follow up on that. So, as bad as I hate to say it, I think we'll probably have to put this into the final resolution off until next month, and I'll do my very best to make it happen by then. I've had, a lot of, issues over the past, little bit, and have been just unable to follow up on that. So, sorry about that, but we'll try to make it happen and get this thing resolved by the next meeting.
No problem. Does anybody have any questions for Nathan or Dr. Reedy in the meantime? No?
No.
All right, moving on to new business. Charlie.
Good morning, everyone.
Morning.
So I have the February 2024 financial report and then the preliminary for March of 2024. You're gonna see that, between February and March, the bank balance does go down, but we got some additional funding in since the end of March, and that bank balance is going back up. Here, see that we've also built out several grants as well. But to jump in for February of 2024, that's 67% through the fiscal year. We have a bank balance of $350,000. We are not in compliance with reserve requirements by $108,000. February alone, revenue $218,000. We're gonna reduce that by salaries and wages of $99,000 and operating expenses of $21,000, leaving a surplus. A surplus for the month of February of $98,000. Fiscal year to date, so July 1 through February 29th of 2024. Revenue $986,000. We're gonna reduce that by salaries and wages of $805,000 and operating expenses of $297,000, leaving deficit through February of 2024 of almost $116,000. Accounts receivable, that balance is continuing to grow on us. It's $410,000. Out of that, $330 3.5 is related to West Virginia Treasury. So we're just waiting for money to come in from them, and we know that that's a valid receivable. That's 81% of our receivable balance. And just do a quick comparison to our budget. Revenue is right on target, at 66.3%, and we're 66.67% through the year. Salaries and wages, 5% above what we budgeted, and operating expenses are 35% above budgeted, or $8,000. One of the things that I looked at was, what we talked about, some of the renovations and stuff last time, but we didn't really talk about the vaccines. That is a large expenditure. So that is a revenue generating expenditure. As of February of 2024, the revenue that we received from vaccines is $161,000, and we've expended in vaccines $116,000, leaving us at $44,000 surplus in vaccines alone. So it's higher than what we budgeted, so that might just be something we need to look at in future years. Were there any questions for February?
I just want to confirm that February is the 4th month that we were operating in a deficit to our reserve requirement.
That's correct.
Okay.
4th month.
That is correct.
All right, and then the receivables you said have gone up in February, and I'm seeing as we get to March, they've climbed even higher. How are the average days to pay, like comparison to maybe 4 or 6 months? Guys, look at 42 days. Like, is our AR aging going up? Or is it
It's
just,
been it's been pretty consistent.
okay,
I'd have to go back and look, but there hasn't been a jump. Like when I prepare it every month, I haven't been like, whoa, that went up high, but I can go back and double check
okay,
and get back to you.
all right. And then over 90, it looks like total 218,000. I'd be curious what percentage of that number is the treasury? Seems like the treasury is the easy one. Like what percentage of that 218? Because that's kind of at-risk AR.
Overwhelming majority
I'm
of
sure
that
it is.
is state treasury, and I'll explain to you why. Yesterday, I was notified that our grant rep at the state had left. And just did it abruptly, did not pass any of our invoicing or any of our expense reporting on to the new person. So the new guy is named Tyrone. Tyrone said, hey, Ashley's gone. Can you send me all your invoices again? So all the unpaid invoices are still languishing there, and they were not forwarded to the new person. So the new person reached out. I'll be forwarding all of this morning. So, and that's probably about 300, maybe about $250,000 of Q1 and Q2 billing that hasn't gone unresponded to.
And based off of the receivables for March, that looks accurate.
Yeah,
Yeah.
That explains the jump.
Yeah.
correct.
All right, no, that's
So-
helpful, because that's where I was going.
The big jump was actually state aid, which came in on Tuesday. The quarterly state aid, the final, the
What's the number?
fourth quarter, it was $155,000.
All right, that's a direct hit on that.
Yeah, that's 150 to 150, it's, almost exactly that number.
Okay. All right, thank
It's
you.
actually a little less, but.
What happened to March? You guys want to listen to March before you accept February, or you want to vote on February?
I move we accept that.
Yeah, I'm comfortable with that. I second.
All right, any discussion? All those in favor say aye.
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 I,
All right, motion passes. I'll hop into the February or March preliminary.
All right.
please.
March 2024, 75% through the fiscal year. Bank balance, $300,000. We are not in compliance with reserve requirements by $99,000. I think this is a good time to note that as of today, the bank balance is $378,000. So if we use the same metrics, we would still not be in compliance with reserve requirements, but by $20,000.
Is there an anticipation that April will close positive?
Yes.
Yeah, it'll be above the reserve requirement.
All right, large degree of confidence, it sounds like.
Yeah, so, what makes us in compliance with reserve requirements, we have cash, but then we want to make sure we have enough money for 3 months of operating expenses.
Sure.
The current 3 months that we're using, those expenses are a little bit higher than normal. And next month, some of it's on normalize, or we expect it to normalize.
Are we
And
still
then we
watching,
also,
we're still washing out like the expenditures for the upgrades and all of that.
Mhm.
All that, well,
so,
the average monthly operating expenses has declined every month since December.
mhm.
Yeah, so
So this still includes
458
December.
reserve requirement in February, 458, sorry, Charlie. In March, 400, so basically a $50,000 decrease in the reserve requirement in March. Where are you anticipating the reserve requirement being for April? Is that gonna continue to go down?
Yes.
That will continue to go down.
And the big reason why is December is still in
Yes,
the,
December is the big one.
December has 3 payrolls in it.
Mhm.
June and December have 3 payrolls, and so December with a 3 payroll is generally going to be,
So that's
boost
gonna
the
be-
average, and that will come off, it'll be January, February, March.
Okay, so this might be 370, we're at 370 cash now, that's
Yes.
the confidence in.
Yeah.
Okay. All right, great.
And then hopefully we get some more collections
Yeah.
throughout the month.
Rebuild.
Yeah.
Which I love, not a problem.
Is, in February, we billed out threat prep and, NEHA, National Environmental Health Association. Yes.
Very good. So NEHA paid,
Okay, NEHA paid.
NEHA paid, Q1 and Q2 of the threat preparedness has not been paid yet, and that's $58,000.
And that is through West Virginia.
And that's also West Virginia Trevor, yeah.
And then, you'll see this as we go through, but in March, build out quick response, $59,000, and then our state allocation of $156,000.
Yep.
All right, so March alone, revenue, $246,000. We're gonna reduce that by salaries and wages of $86,000. And operating expenses of $15,000, there was a surplus for the month of March of $145,000. Fiscal year to date, so July 1 of 2023 through March 31st of 2024, revenue $1.2 million. Reduced that by salaries and wages of $891,000 and operating expenses of $311,000, leaving us a surplus of almost $30,000 through March 31st of 2024.
Don't spend it.
We'll be okay.
Yeah.
There's
And,
also another big kicker company that started at the beginning of April, so.
I'm gonna compare that to our budget real quick. Revenue, 8% above budget. Salaries and wages, 5% above what we budgeted. And operating expenses, 33% above budget. That's about $22,000.
Yep.
To kind of go back into what the clinical immunization revenue and the vaccine expense looks like. The revenue is $167,000 and the expenses still holding at the 116, leaving us a surplus of over $50,000.
The operating expense, the variance to budget, $23,000 over the budgeted amount.
Yes. Yes. Receivables. Again, we see that big jump and we billed out $215,000 to West Virginia in March. So accounts receivable sits at almost $613,000. $525,000 of that is related to West Virginia Treasury. That is 86% of our receivable balance. 243,000, so, just what Gina was talking about is over 90 days. Any questions on March 2024 preliminary reports?
I'm here.
And I am trying to push them on the grants.
Tyrone?
Tyrone, yeah.
And I think it's
I thought that would be
I
interesting.
mean, Gino.
important to know.
Yesterday morning.
Gino, please, correct me if I'm wrong, April's when the permits will be.
Right, so we just, so
Just
Patty just
started.
billed out build out permits, that's usually a big kick of anywhere from about $250,000 or more. And that usually pays over the course of the next 2 months. So that will add a nice little touch to the bottom line in addition to getting these grant payments finally in. Remember, the threat prep grant didn't come through until the end of December, even though we were paying out on the threat prep grant salaries and everything like that. That was supposed to be reimbursed. So I wasn't able to bill it to January, and they're still sitting on it. So that's what happens when the grants department turns over, like it just recently did, evidently.
Grant Department of one.
Yeah, there's multiples in there, but there's always your high performers, and those are the ones that tend to leave.
Okay, moving along to, our preliminary FY 25. Did you send the document on for that?
For which one?
The budget.
Oh, the preliminary budget. I'll be completely honest with you. The state has yet to come up with state aid.
Okay,
So I don't know how much state aid will be. So the numbers are unchanged from last month. Unfortunately. And I also don't know if the county will be contributing anything either. So
probably not.
probably not. And that's how I left it blank, and I'll continue to leave that one blank. So as soon as I get an answer from state on state aid, then I'll be able to have a little bit more firm budget, and I can send that to you on prior.
I was gonna say, can you send?
I'll send that out,
in
and
advance?
yeah, I'll send that out as soon as I have those numbers.
The goal is to approve it next month, right? May,
Goals.
that's the goal.
But if we're not set, we'll have to do a special meeting.
But we can do it in June. It has to be done by the end of June.
Okay. I thought we had to have it in like mid-June.
No, not anymore.
Oh, okay.
Program plan goes in on June 30th.
Oh, okay. All right. So we've got a couple months.
We have two more meetings. I'd still like to get it done in
Same.
May.
Okay. Environmental fees.
Thank you.
Thank you.
Yeah.
Yeah, thanks, Charlie.
So we decided to go ahead and submit these for consideration. It's almost the same as what you looked at before with the 20% increase in fees that we're proposing for next fiscal year, especially considering we don't think we're going to get funds from the county, so. The points for consideration are our total revenue from EHBs last year was 408,000, and our current EH salaries and benefits is 450,000.
What are we looking at? Can you point us in the right?
Oh,
she
I'm
just
sorry,
has her
I just
talking
have my own talking for it, so. yeah,
So we're
I can
talking
cover
about the
that.
environmental health fees.
Yes,
So are there changes to this that are being proposed?
yes,
Yes.
it's,
Are they
it's about,
helpful?
yes. So this is the proposed increase in fees to start next fiscal year, so sometime after July 1. So my proposed start date was July 11th because that's after the 10-day grace period for late applications coming in from our establishments that are being billed right now.
Have like the current fees versus the proposed fees.
I have one copy of it here. If you have any questions, I can go over that with you.
I'd like to see it. So
Yeah,
actually,
Same.
this isn't-
I have one copy of that, so that's the current fees,
Isn't that what
and
we-
then those are the proposed fees.
So which one's proposed and which one's permanent?
No,
Because
they-
these are identical.
Which, no, they're not. Yours
Okay,
should
so
be-
this didn't change.
No, I didn't change that one.
Okay,
So,
Can we go get
That's-
copies of that?
that's
real quick?
previous.
yeah, I can turn out some copies, but yeah, if you want to give that to Karen to look at. well,
No, but just go get a copy of it and so everybody
So you
has
just
it.
need
and
Yeah,
then
I'd like
pages right here.
Okay.
We'll put you on pause and do
That's
other stuff
fine.
while we do that.
I'll turn it over to you.
Thank you.
Thank you.
Yeah, I wish I had something to tell you about the budget, but without state aid, considering that makes it about 32% of the total budget, that's a huge hole without knowing what that number will be.
Yeah.
I don't need 1 billion. I already know. I've seen all these fees.
Yeah, and as far as the county, it's just the budget challenges they have. Is kind of why we're thinking that probably won't come through.
Correct.
Yeah, I heard.
And
something about
historically,
that.
they haven't given us money either, so
Yeah.
it's not.
It'll just be continue, it's easy to continue the trend, yeah.
Absolutely.
So do you want to go to threat preparedness?
Yeah, let's do threat preparedness. Just introduce yourself, Brandon.
Yeah, my name is Brandon Wonder. I new Mason, as everyone might know me. But the new Mason, that's what everyone's calling me now. So yeah, I know. Eventually I'll get over that. But but just give a little background. I have similar to Mason. I have a background in meteorology, bachelor's, and then I just finished a master's in emergency management in January. Did an internship over in PA, with the local government there, through emergency management. This, position is my first full-time emergency management position. And yeah, I mean, I look forward, excited to go along with it.
Cool. Tell us about the circulation that happened last night.
Well, actually, as I tell you, I saw a tornado warning. I got the big warning of it last night when I was sleeping. And, yeah, and I saw it, and it was actually a little scary last night.
Yeah, I didn't get it.
Martinsburg,
Yeah,
Inwood, yeah.
It felt weird down where I was.
It was-
Weird that we're not getting alerts, but I guess it did.
No, yeah, no, there was definitely some rotation there.
Yeah.
Yeah, it was a little scary, yeah.
What time was that?
About 12:30.
12:30?
Yeah, 12:30 in the morning, yeah, and it was raining, yeah.
It was howling even down here.
Yeah, and the thing, if it had happened, it was all rain wrapped and it was dark, so it would have been not too great. But from a meteorology perspective, that would not too great, but
But cool for me.
but cool, also cool, yeah. It was a little lighter and cooler.
Yeah,
but
he's
yeah.
not like, this is awesome. I really want to tell you all about it. Thanks, Brandon. Anything
Yeah.
else?
Oh, no, we'll be doing, me and Gene will be doing the ICS 300 training this weekend, but besides that, nothing else.
Welcome to the team.
Thank you,
Welcome.
thank you.
All right, political activity?
There's one right there too. There's one in the packet. Is there a packet over there?
This is Ann's packet, and I was just referring to the financials.
I know you were in the middle of something before this.
Yeah, I had a meeting.
I know.
Apologize for my later amendment. All right, so for clinical activities, family planning, we had 6 encounters, breast and cervical cancer screening program 4, sexual transmitted infections 15, vaccinations 63, and TB 9. All these numbers are expected. Nothing much different. It's the month of March and April. So one thing I did want to inform you guys is that as of April, our family planning program is changing over. The way the states do, the grant's been taken away, but we're still involved in the family planning program. But through the program, we will be able to take patients who have insurance and be able to bill insurance.
You will or won't?
We will.
Okay.
So that's one of the things that family planning program really wanted, that the insured be offered services and be billed for those services. And the family planning would cover just those who are uninsured or underinsured. So they really wanted to distinguish that and make sure the funds go appropriately. So we are currently in the process of changing and incorporating that. So our nurse practitioner, Leah, she is currently, we're trying to get a credential, so she will be able to bill all the insurance, to see anyone for any insurance. So we are in the midst of that right now. So as a health department, we'll be offering sexual and reproductive services. And underneath of that, we will have family planning, breast cancer and cervical screening, and then insured individuals can receive services as well.
What will be the new name of the broad program?
We've been debating it. Women's Health Services was brought up, but I also, because men can also get services, it kind of alludes to the public that it's only for women, when that's not the case. Anyone to give sexual reproductive services should be able to come, and no matter what your gender or sexual orientation is. So Dr. Rady suggested maybe leave it as sexual and reproductive services. So it does not,
We'll talk about that later.
yeah, so that's, we'll see what we'll do. But in-house, we're just calling it Women's Health Services, so what we say to the public might change.
Cause that'll have to go.
Leah gonna be working more.
We hope so.
We hope so. She's definitely showed enthusiasm. She loves working here. She's vocalized that quite a few times. And so I think there is an incentive, and she's alluded to that, but nothing is final or written in stone. But we hope so.
Yeah, it's nice having a very much committed nurse practitioner for reproductive health, so.
Any questions on political?
Curious what you guys come up with for the new,
Oh.
can't wait to hear it.
So we are doing extended hours for childhood vaccines. So not just till 4, but till 5, we'll be here till 5:30, a couple days a week. We have it up on our website. You can go to our schedule, our calendar, pull it up and show you that. What the days and times are for those extended hours for anybody who, is interested. We'll make sure it's out there in the public.
Thank you. Dr. Reedy, would you like to do your health officer report?
Yes, so I'm at a annual West Virginia HIV meeting. And that's become an increased concern because cases are going up in West Virginia after many years of being not so great. And that's mostly related to the drug use issue. I sat next to a counselor from Charleston yesterday who has over the last year or so individually told 42 people that they had positive HIV tests. And that's a concern because there's several counties now in West Virginia that's happening, and there's nothing special about us that doesn't put us at risk. So one of our goals we've been doing is trying to do more HIV testing. As Lindsay said, our routine programs are continuing. Our big challenge is outreach to try and get other people in who need services that we provide. We've been talking to quite a number of different community providers of substance use treatment, as well as people who also work with them, such as the regional jail, the Jefferson Community Ministries, and we're discussing ways to collaborate with Jefferson Community Ministries so that we can get more referrals from them and we can help them with some support services of perhaps even doing some clinical care at their facility, which is more centrally located. Our distance from the population center is an ongoing challenge because some people, don't have good transportation, and also we're just not visible. One thing we'd like to do for some of our services, some things like family planning and some vaccines for people who have low income or uninsured, we have funding that can cover it, but we don't have a set way of deciding for people who are low income and uninsured for services that we can provide, how we can have a sliding fee and discount fees for certain individuals. That's got to be done by a formula, means testing, things like that. And so that's something we're going to develop and bring to the board.
Is that gonna
Right
be?
now, it's
Josh,
excuse me?
is that formula gonna be, is that state determined or we determine what that formula is? How does that?
So there are federal guidelines of what the poverty levels are, and we would decide if for, let's say, $100 fee, if someone is below the poverty level, how much would we charge them? And we decide what things we would discount, such as if someone is seeing Lindsay for substance use problems and it's $100 fee, Lindsay's service we're already paying for, we could discount it. But if she were to prescribe medication or do blood tests, we would have to pay the vendor for that. So that would be an additional cost to us. And so that's something we'd have to go through item by item, what we can discount and what we can't, because it would cost us money, provided there's not other funding for it. So that gets into the weeds pretty quickly, but it would be our determination, and the board really needs to be involved in that because that's a big fiscal piece as well as policy. And that way we have a set program that we're treating everyone the same, that if someone comes in who's my friend or another doctor, they don't get free services. They have to pay what the fee is, unless they happen to be low income. And then we'd apply whatever the formula is. We do that for family planning program and for, I believe, for some of the immunizations. Some are covered, some aren't. So this would be extending it to other people, especially people who, for example, someone with a substance use disorder who just needs a general physical examination. We can certainly provide that, but it is a work that should be reflected in our income. How much that person should be expected to pay is that's a different matter. But so if we're for providing the work, we should show how much money we've spent, even if we don't get that income from someone else. Hopefully, there would be other entities in the future that would be reimbursing us for the amount. For example, with the federally qualified health centers like Shenandoah Community Health, the money that they don't charge on a sliding fee is then offset by federal funding. We don't have such federal funding at this time. On Monday evening, the 15th, from 6 to 8, the County Commission has a public opioid workshop. I will be presenting some basics about where we stand in the county with substance use issues, especially opioids. This is not for making any requests for money or any specific recommendations, but to give a background. Other speakers who will be presenting the basics will be from law enforcement, I think the prosecutor's office, and then there will be, my understanding is, open public forum. So this is not the time that we would be requesting funding for from the opioid settlement money. So I will not be making specific recommendations to the county commission.
What time is that workshop, Dr. Reedy, on Monday?
6 to 8, and it is on the county commission website on their calendar.
Thank you.
I think that's all, if anyone has any questions.
None here.
All good. Anybody else? Thank you, Dr. Reedy.
Have fun down there.
All right, we'll go back to Gillian on the environmental health.
Okay, so now you all have a copy of the current fees that you just approved. And the county commission also approved. Those have been filed in the clerk's office. So these are the current fees, which are the same fees that we've had since 2020. So the proposed increase is 20% for most of the fees. And some it's a little less than that. So, and the ranges go from a $12 increase to a $100 increase for the most part.
Which one has 100?
So it's just like the larger food establishments and larger hotels, things like that. The food establishments with 81 plus seats were 500, and those would go up to 600 with a 20% increase. So, do you have questions about the specific increases? Do you want me to go over all of them? There was one or two new things added on to the new list, because one thing that we've come across recently is somebody was asking about a temporary tattoo studio or event type thing, which are allowed, but we've never had that happen here. So we've never really had it on our fee list. So I just did this is what Monongalia County does because they have a large event every year for temporary, like a tattoo festival. And this is the charges that they use for that. They charge $100 per artist that comes. So that is a new
For
charge.
temporary tattoos?
No, it's a temporary tattoo studio, permanent tattoo, like actual.
Oh, okay, so I'm like, why?
No.
Like, I'm sorry, that's way
No,
over reach.
no. No, for
I'm gonna start
actual.
drawing, are you gonna call it cost and charge
Actual
$100?
tattoo.
Real tattoo.
Okay, gotcha,
yes.
temporary
Real needle
studio,
going in.
real tattoos, okay,
Right.
got it.
A temporary studio
So we,
for tattoo.
we permit tattoo studios, that fee is set in code, however, we have been told that we can charge our own fees for these temporary events.
Which
so-
you've only had one in your time here, right?
Well, it
And
hasn't
they
even
haven't
happened yet, I got a question about one, so.
About the tattoo.
About somebody doing a temporary, like, going to a temporary event to do tattooing,
Okay.
so,
That's a great way to put it.
yes. So.
One-off tattooing.
Yes, so the state actually does have policies to follow for that, but, and the other thing that was added in here that I had just forgot to include in the last set of permit fees was the, bed and breakfast food establishment fee that we had, we had a separate, food establishment fee for bed and breakfast, so
But that's like over,
it's with the food service establishments.
so you get charged a bed and breakfast fee and then you get charged a food.
Yes, because they have two different permits. So they have a permit to operate their kitchen and a permit to operate the bed and breakfast.
And that's
And I
what-
didn't change those fees. So those are the only ones that I didn't increase at all because,
The regular bed, like just the bed and breakfast. one.
and the bed and breakfast food establishment
Well,
one.
it's
Those-
showing
Well,
150 here and 125 here,
no,
Yeah.
I'm not sure what you're looking at.
what you gave me, as the
So,
old fees,
no,
small
those-
establishment. bed
no,
and
that's a
breakfast.
plan review. That's the plan review. I'm talking about the permit fees. So if you look here at the permit.
No, I
fees-
saw that, yeah,
Well, that's what I'm talking about, that and that.
okay, so,
So the plan review fee is, those have changed, it's 20% increase, I think, for the small plan reviews, but I didn't increase it that much for the larger plan reviews. I wasn't speaking about the plan review fee, that's for new bed and breakfasts.
so my personal opinion, and colleagues maybe feel differently. I'm not gonna vote on something where it's, oh, we forgot that, there's this document, that document, can we get this presented and here's what it currently is, here's what we propose side by side, so we know exactly what we're voting on.
Okay.
Can we
Yeah, you
justify
also-
not making these the same across the board and all of them being 20% instead of picking and choosing?
So the only one that I picked and choose with was the bed and breakfast, and that was only because of
Just did
previous
those.
discussions
Well, we
about
just did
those, right? So,
Yeah, we just lowered them.
yes, we did. We have not increased them, so.
Well,
So
but we
that's the
lowered
only
them because it
reason.
wasn't in alignment with state code because they were just like,
No,
they were getting different. They were being charged, I thought, like a hotel cost, not a, there was something to do
no,
with.
so what it was the short-term rentals that they're charged as a hotel motel permit. And their fees were $125. Well, the bed and breakfasts were being, they still had their $60 permit fee, but they also had $125 food establishment fee for a small food establishment. So we lowered that fee for them. So we actually lowered it to 65, not 60, so it would be in line with the short-term rentals. So that's what happened with them, and that's the only reason I didn't make a change to that, so. And then the other, the plan review fees were, some of them, I just didn't go up 20% on all of them, that's all.
One of my questions, and I just, you've already explained it to me, but I want forward to hear this. What amount of staff time does it take on a regular basis to permit a well? or a septic?
That takes
How much staff
a
time would you say?
significant amount of staff time because we're doing sometimes multiple site visits. We're also doing lots of paperwork that's involved with that. It's just, it ends up being a lengthy process, even if it's a denial. If it's a denial, sometimes it's an even longer process, so.
Let's just say for discussion's sake, that total compensation for sanitarian runs about $37 an hour. With health insurance and all the things it costs. Would you say that a septic permit could take in excess of 10 hours,
Yes,
20 hours?
it depends, but yeah, some of them.
So what?
And some of them take multiple steps time, so because we're taking, one sanitarian goes out, they want a second opinion, another sanitarian goes out. And they ask for another hit for whatever reason, and there's another site visit involved there.
So it doesn't
And
even,
the paperwork is significant too,
so
so.
the $37 an hour for one sanitarian to participate doesn't even include mileage.
Right.
So
If
370,
you have an actual, like, look,
I'm just curious.
No,
I
well, you guys can sort that out. We can ask the question.
Right.
But if there is a formulaic that you can say, this is the average, and I'm talking real numbers of the average septic system approval process, then put that together to justify it.
I'd like to do that.
So I think that's that, and also putting side by side what it is that it was, where we're going, complete, not missing in different documents, because I think if we're gonna be talking about or considering kind of any kind of fee increases, we wanna know what exactly, I wanna know what I'm voting on. Also, I'd like to know what the bottom line is on the budget. What is it this year versus what the proposed would be that year, because we're obviously gonna have to consider this as part of our holistic budget.
Yep.
Which is obviously.
Yep.
You'd like to get done next.
Yeah,
next
I'd
month.
like if we have an 18 or 20% increase across the board in fees, then I can make some predictions on.
But I
what
think you need to
potential
look at it flat versus, because
Yep,
this is,
Absolutely,
especially septic, you're gonna have a lot of opposition. We're gonna have a lot of opposition.
absolutely.
And with the cost of everything else. So let's get the actual formula of what it actually costs in a real case scenario, not worst case, not best
Yeah,
case,
average.
average. And side by side. And bottom line numbers from the total budget.
Good.
Yeah, I'd like to go back to the, things that haven't been updated since 2020, is that what you said?
Correct.
Prior to 2020, how often were these fees updated? Like if we were to go back to 2010, is it annually up until
I
COVID?
can't really speak for
Yeah,
that, so.
do we have, does anyone have access to that?
There,
I'm just curious
we
what the
may have
cadence
some
was.
records on that, so, yeah. We may be able to find some records, we should have.
It almost just seems like, 20% just sounds a lot to me.
Mm-hmm.
But if it's been 3 years, you know what I mean? And I'm just wondering, like, if there's an annual cadence of a
Yeah.
5%, like, that's more palpable and it's something that can just bake into the model where the public understands it, the cost of everything's going up.
So I know it wasn't annually because it was whenever the state updated their fee rule to allow it, the state used, the fee rule that just got repealed would set the maximum fees, and as long as the health department had already adopted the maximum fees, when a new fee rule came in place, they could adopt the new maximum fees.
Okay, so you're kind of limited by the state rule
Mhm.
on that.
But now there is no maximum, but we do still have to get county commission approval with that was the thing we just dealt with a couple months ago. So we need to be tight in what it is we ultimately vote on and or approve, because it still has to go through the county commission. And we have to have a couple different budget scenarios, because they could also say, no.
Yeah, and the justification, maybe the septic calculation is, but that's only one thing of all of this, and I think there needs to be a more global justification for that increase. And like you mentioned, like 400,000 in revenue under the proposal, like what would that, or under the current, what is that with the proposal? What's that net differential and why do we need those extra funds? And I think the septic becomes a part of that conversation. There's a lot more going on here than just septic too.
And maybe making that comparison as well with the restaurants and or the hotels. with how much time it takes to do those inspections versus a septic, which some of those permit fees are significantly more than even a septic permit fee, you know, and how much time does it actually take you to do those? And I'm guessing that's significantly less than a septic permit.
Usually, yes.
You know, even if you make 2 visits a year, that's probably still significantly less, isn't it?
For the most part,
Mhm.
except for problem.
Well, you always have a few problem
Yeah.
children and all of these things.
Gillian, I have a question.
Yes,
So the state is already pay for the employees to work on these, right? So the fee is just that what we charge on top of what the state pay for the employee. You get paid to work like what, 40 hours a day?
They don't
I'm
get paid.
sorry, 40 hours a week. I'm sorry, it's still early, haven't had coffee. So why does that have to be considered into the price that you charge? Do you pay your employee overtime? Like, you know, you have to consider that number into the final proposal, please.
I think what she's asking, because we hear about all these VHA grants, sanitarian
Oh,
money, we
right.
get like, we got grant money for a sanitarian that just came in. So I think that's, I don't want to speak for him, but I think that's what she's saying. So if we're getting grant money to pay for them to be here, then how is there a justification?
that grant money
fees.
expires at the end of this year, so
So-
we do not have grant money to pay for.
Okay, so if that's the
position.
That sounds like.
So that's a data point. We
That sounds
like that's.
justification for the-
I think I clearly articulated the last time I was in front of the county commission that one of our sanitarians was paid for by a grant and
Mhm.
without any forthcoming. Aid from the state or from the county would probably necessitate a reduction in
But that's a
staff.
data point we
Yeah,
need, because I think
absolutely.
to Ann's point, she's saying, I don't understand why, you know, how does the fee relate to, say, paid for position? So I think that's
So
a
this
valid data point.
The state of West Virginia does not pay for any staff here at all.
Right.
That's all paid for out of the general fund of the health department. State provides about 31% of all operational funding here. So if we just accepted state aid
Mhm.
and didn't earn any other income or any other revenue, we would probably be a staff of 5.
But again,
Okay, but we still receive state fund to hire employees, so it have to be accounted to for the septic side, you know, somewhat. So what percentage do we use? You know, you have to, please put it all in the budget proposal. I'm not saying it's right or wrong. I'm just saying I want to see that number.
All right,
That's all I have.
sounds like we need to represent this in a better manner.
and like, while we're on the topic, if I may, I'm just gonna say, it's the same thing with the conversation that we had around, the appeal process, right? We asked for side by side, what does current language say? What does proposed language say, especially if we're trying to be in compliance with state law? So I think anytime we're looking to make a change in something, it's really helpful to have, here it is today, and here's what we're proposing.
And the rationale
And the
for why we're
rationale.
proposing change.
I'm sorry, you're looking at us like we're crazy for asking this, but it's, I think, legitimate request.
No, I'm not thinking that at all.
Okay,
I've sat in your seat on plenty of boards, so I understand exactly where you're coming from.
so I just want to make sure that's,
It's
you know,
clear.
I don't think we're asking for
Nope, it's clear.
anything else. And do you have any other questions?
No, I'm good. Thank you.
All right, Gina.
So anything strange on the environmental report?
No.
Oh,
Nothing out of the ordinary. I didn't think so. I looked at it when it came in last week, so. I don't have too much to say for the administrative report. We will be hopefully hiring for an office assistant. I put that out to DOPH. I gave you the rundown on the grants department, and hopefully we'll be receiving reimbursement soon from the grants department, since we now have a new grants department rep for the salt
That's
department.
Tyrone.
His name's Tyrone, that's what he said. You give me a last
I hope
name.
he's telling you the truth.
Now, the other lady's name was awesome too. Her name was Ashley Lewandowski.
Oh.
So that was nice.
Rolls off the
So you
tongue.
just learned how to spell it and then you left.
And then, well, it took me a year to learn how to say it and spell
I can't imagine what that email looked like.
it. It was complicated.
Ashley L.
Ashley L.
Hopefully, hopefully.
But she did a great job, but I didn't know she was missing, so we were still submitting to her, and evidently that was not getting to the next level.
Right.
So I sent an email again and said, hey, what's going on at Bureau, at EPH, Bureau for Public Health grants, and he responded to me.
Anything else?
I just want to go back to the fee increase discussion, just from my point of view, I'm looking at it, as the newest board member coming in, as citizens of the county and all the cost increases that are going up, like, it's everywhere we turn, and there's almost an expectation that's kind of baked in, but I would imagine that some would be like, hey, well, that's my, that's just one more place that I've got to shell out. And I look at real estate and how are these younger adults gonna purchase homes? How are they gonna launch? And it's like, just everywhere we turn, everything keeps going up and there's gotta, I anticipate some pushback. And if we don't have a clearly articulated rationale, and I'm not saying that we don't, but I don't think we've heard it. I know you've got talking points and maybe sharing those talking points, in writing prior to the next meeting or something like that, but it's gonna be open for public comment, like, you're probably gonna get the same thing from the public that you're getting today, and are you ready to have those discussions? And that's how I'm looking at it, just.
Because it's also, and to add on to that, because again, it looks sort of seemingly innocuous if something's $100, right? Okay, so it's, we all pay $100 for something we need or want. But also when you're looking at some of the like especially in the housing development space, there's multiples there, right? So it's not just $100 out of the pocket, it's 100 times 100, right? Or more, or some variation of that. So that's, I think, again, why we need to kind of be clear on the rationale, the side by sides, and what those impacts are gonna be.
Yeah, and maybe even having part of the proposal, what does a 3-year plan look like? And what is the cadence going forward so that the community can better know what to expect as far as rate increases? Whether it's annual, whether it's every 3 years, they're gonna be looked at so that they know, like, oh, well, that's right, they said 3 years, not that they'll remember, but at least it was said. That cadence, and do we take this 20% over a 2-year period versus one? I think there's a lot of variables, and I guess the public gets to weigh in and the commission gets to weigh in, but starting to think about that stuff, ahead of time, maybe just anticipation of some of that.
And this is all new, considering previous to this, the state said, this is it, and we just said, we would like to charge the maximum.
Yeah.
Exactly.
Yeah,
Now
that's a
it's
good point. Now
completely-
the
this is a
responsibility
completely
and
different-
ownership is yours.
Yep, that's ours.
Ours, yeah, fair enough. Yeah.
Well, and you've made a complete cycle here too. Also, we used to get funding from the county commission and now we are not getting funding. So we've had a lot of grants coming out of COVID, which are now beginning to dry up. So, life is sort of in a different position that we're gonna have to figure out how we're gonna fund these things ourselves, and a rate increase is simply
It's
gonna have to happen.
Potentially part of it.
Right, it's one of those things.
That's a great point. That's a great point, Ian. That should be bullet point number 2, if not 1.
But it also can't be anecdotal, it needs to
No,
be
absolutely, let's be concrete.
data driven. Because again, we're not unlike the previous system. The county commission also has to approve it. So they're gonna be asking all these questions and need to have the justifications because they're gonna have to make decisions too.
And I'm guessing that this decision to raise our fees will probably also stop us from getting funding from them as well.
I'm sure. Well, that was kind of what Pasha,
Yeah,
that's kind of what Pasha had said at the
Right.
time when we had asked, he's like, this is not a rate increase, and we said no. And for the approval of the standing
Mhm.
permit
Right.
fees, and he was like, well, that's possibly, and Nathan said that too, it's possibly somewhere to increase funding without seeking county. So
there
county,
could be
the rest
some
of county,
support
the
for-
operational support.
There likely could be support from the commission.
It would be de facto, wouldn't it, if they voted for it, or something like that, so. Otherwise, I don't have anything else to say.
All right, our next meeting is May 10th. at 9 AM. Is there a motion to adjourn?
I move we adjourn.
My second.
All right, all those in favor say aye.
Aye.
We're gonna swing it.
Aye,
Thanks, everybody.
Well, thank you.
thank you.
Not yet.